Welcome back as we power through and get into our fourth lecture in our series, Vestibular Rehab from a Therapist's Perspective. So in our last lecture, we had a discussion on treatment strategies for unilateral vestibular hypofunction. I just wanted to add to that of course sometimes a patient could have bilateral vestibular hypofunction. That's usually due to side effect of having taken drugs like aminoglycosides, and sometimes they could have dizziness that's coming from central causes, like if they had a stroke. Even in those conditions, it would be effective for them to be able to do some of the same strategies that we discussed in the last lecture, and they would still see results. Only thing, because it's bilateral or central, it might take a little longer for them to be able to see results, and the results might not be as thorough. That being said, let's come to today's topic, which is BPPV. Dr. Jacqueline Gomes here again, and we are discussing benign, paroxysmal, positional vertigo. Again, remember that's the condition where the crystals are out of place in one of these rings. The crystals, remember, in our inner ears need to be in these sacs, but instead of being in the sacs, in this condition, it is out into one of these rings. And so with certain positions that the patient takes, he gets that spinning sense of vertigo as long as he stays in that position. So there are two places those crystals can get out of place. They could be stuck right here at the junction of the sac and the ring, or they could be free flowing in the ring. If they're stuck right here at the junction, then as long as the patient is in that position, he will continue to have that spinning sense of vertigo. If it's free flowing, then in a few seconds as the crystals settle down to gravity, he'll stop spinning until the time that he goes back into the original position, and then he can feel that spinning sensation again till those little crystals settle back down to gravity. So what are some of those positions that cause him to feel the dizziness? It could be looking down, looking up, rolling over in bed, laying down in bed, coming back up to sit. Any of those positions can provoke those crystals to move and him sense that spinning vertigo. So what are some of the causes that cause it to happen and to come out of those sacs in the first place? One is just by age. So anytime over the age of 40, it's seen to happen. In females, actually it happens 2 times that in males. In the presence of osteoporosis or lack of vitamin D, they could happen more easily. Or sometimes if the patient's had a whiplash or head trauma, it could come out more easily. There are certain treatment maneuvers that depend on which ring the crystals are out that help put it back in. These maneuvers are very effective and very impressive how they actually can get all those crystals back out into the sac. Sometimes the treatment maneuvers need to be repeated more than once, but most often with just one single maneuver, it's all completely taken care of. So that being said, let's get into our final lecture where we talk a little bit about diagnosis, finding out in which of those rings those crystals are, and a little bit about the treatment for them. See you soon.